Good morning. Welcome to today's Facebook Town Hall, or Facebook Live. We're going to start off with Dr. Lutz, and then we'll talk about the telephone town hall. So, Dr. Lutz.
Well, good morning, and I hope everyone had a good weekend. As you will hear, over the weekend we did have an increased number of cases. These were specifically related to an outbreak in the Spokane Veterans Home. So, what I'd like to be able to show with this graphic is you can see overall our numbers have increased, but you can also see that they are leveling off, which is very encouraging. And then with this next graph, what you can see again from this graph is that we started here on March the 14th. Our numbers went up, but now gradually they are coming down, which for me is a note for guarded optimism. So again, I think that we have talked about the importance of staying home and staying healthy. I do believe that the physical distancing that people are doing is making an impact, and I think these numbers are suggesting that. With respect to total number of cases, however, we do have 275 cases identified as of today. We've had 15 people die from COVID-19, and the most recent individual was a woman in her 50s. So, I will tell you that all of these graphs will be available on Facebook Live in the next few minutes or at some point in the near future. And I also want to let you know that at the Health District and available on the website for COVID-19, we now have a new feature that is breaking down the cases by zip code. So that's important for people to get a sense of where the different infections have occurred. We have not had any real hotspots, but not surprisingly, those areas with the densest populations are areas where we are seeing more cases. I'll also let you know that on the state website, you can see actual other breakdowns by cases, also by race ethnicity, which is an issue that is of some concern. People have brought it to my attention, and the state has, again, recognized the importance of having that information, and so it's now available on the state website. So with that, I'll turn it over to Brian.
Good morning again. Brian Coddington here on behalf of the Inland COVID Response Joint Information Center. So hopefully many of you were able to participate in or watch the community town hall last Wednesday evening. The town hall was hosted by Dr. Lutz, who we just heard from, Spokane Mayor Nadine Woodward, Spokane Valley Mayor Ben Wyck, Spokane County Commissioner Al French, State Senator Andy Billig, and Spokane City Council President Brian Beggs. We're joined this morning by the co-hosts to continue the discussion about the community's response to the public health and economic emergency. Commissioner French is unable to be with us today due to previous commitments to keeping the county business running, and we appreciate his time and participation and his candor during last week's telephone town hall. We're going to start with a quick overview of the data before we invite Dr. Lutz back to the podium to be followed by the elected leaders. Each will have a few brief remarks. They're going to answer a couple of additional questions that we weren't able to get to last week and take any questions at the end of this that we haven't been able to get to. So the telephone town hall gave us a chance to be engaged in a little bit different way with a little different audience that we've seen. Typically, we've been doing these Facebook Lives on a daily basis. We've responded to questions on social media. We've been interacting in a much more digital way. This gave us an opportunity to be able to be engaged with a bigger segment of the population countywide. We had about 9,200 people over the phone talk to us. And about 50,000 people joined us on Facebook Live on the Inland COVID site, as well as some of the major media sites around town as well. So a very broad, very wide audience we were able to interact with. It gave us a chance to check in to see how we're doing with the community, both in terms of the information we're providing and also the response that we're doing. A few takeaways from the town hall. The first question we asked was about how concerned are you? And probably no surprise, people were very concerned. So 60% or so moderately to very concerned. About 7% indicated they were not at all concerned. So good for us to be able to check in and reaffirm for us what we thought we knew already. Sources of information, how do you get your information? Again, another good way for us to check in and know from people whether we're reaching them the way that they would like to receive their information. So 53% said that they got their information from television news. About 24% are getting their information from COVID response websites, so whether that's the Inland COVID response site, CDC, State Department of Health, those official government type sources. And those were the two far and away the most highly indicated sources of information. We also asked about what people were most concerned about, and again, not surprisingly, about 2/3 of people are concerned about either contracting COVID or others not following the stay at home, stay healthy order and spreading COVID. We asked about how people have been impacted over the last several weeks by the response to COVID. About half said all of the above. We asked for 4 other options: food, household supplies, stress, loss of employment, and anxiety for friends and loved ones. Each of those was pretty evenly distributed, so half made sense that all of the above was the right answer there. And then priorities. We asked about what people's priorities are in terms of response to the COVID health and economic emergency. And nearly 2/3 said supply of healthcare equipment and economic relief were their top priorities. So again, not a lot of surprise there, but good for us to be able to check in and hear from the community and know what the feedback is. So next steps, we're going to spend the next few minutes answering some of the questions that we didn't get to. We'll spend the next few weeks answering those questions also online and really trying to make sure that we're pushing the information out to where it needs to go. We'll also be working on clearing up any misperceptions that might be over the next few days as well. So we'll start that right now with Dr. Lutz joining us to continue our conversation, address a couple of pieces of information that we didn't get to last week. So each of the speakers will have 2 questions that they're going to try to address, and with a few opening remarks. So if we can start with Dr. Lutz.
Well, hello again. So specifically, as I mentioned earlier, we're still seeing new cases, but I'm encouraged guardedly that the numbers that we're seeing reflect the fact that the governor's stay home, stay healthy message is having an impact, and people are abiding by those guidelines. Again, I think we need to keep this up, because what we don't want to have happen is a resurgence of the virus that's going to put us back. So I also think that people should know that the healthcare system is strong. We were benefited last week by having Vice Admiral Bono visit our local area. She visited with healthcare executives, and she was very encouraged by what she saw. So I think it's a real credit to us as a community and the healthcare organizations that they have been able to work together to really prepare for this. And thankfully, at this point, I can say that the healthcare system is strong. We've not seen the surge, but we have to be ready for something like that. So again, it's important to reiterate the stay home, stay healthy message. I understand certainly the pent-up demand to do things differently, but we can't return to normal at this point, because I want to make sure that we do return to normal at some time in the future. A couple questions that were asked of me to touch base on. The question was, do carriers of the virus only carry it for a certain length of time, and what is it? So this is a novel virus, and what we are learning is that it does not fit one specific picture. We've seen that depending upon a person's immune system, they may be able to fight off the infection more quickly than in other situations. We have been able to detect virus, however, up to 30 days after someone has been infected. And so it's difficult to say exactly how long it lasts, but again, with a good immune system, that's why we encourage people to, again, take care of themselves, do all those preventive things to keep their system strong, and why, conversely, we are telling people who have maybe stressed immune systems, who may be at more risk, to avoid going out because they are going to be most susceptible. And then question 2, how do the number of deaths compare to a bad flu season? Certainly locally and nationally, our numbers are much less than what you would see with a bad flu season. So for example, when I looked at the numbers for last year, on average, we'll see 24,000 up to 62,000 deaths per year from flu, with maybe up to 750,000 hospitalizations. You know our numbers are much less than that. I think the thing that's concerning, however, is that this is a novel virus. We're familiar with what the flu brings. We're not so familiar with what this novel virus can do. And so I think that's part of the concern. We want to ensure that we have a strong healthcare system. We also, with the flu, we have a vaccine. We do not have medications for this. And so until we have a vaccine or we have other means by which we can really fight the infection, we're going to continue to recommend the stay home, stay healthy message. So, thank you.
Spokane Mayor Nadine Woodward, good morning, everyone. Thank you for joining us. I hope you all had a good Easter holiday. I don't know about you, but it gave me an opportunity to reflect on all the good and the greatness that we're seeing in our community as a result of COVID. And I think sometimes that's what incredible challenges do. It brings out the best in all of us. And we have lots of examples of that. We see it on the news every night. We see it in the newspaper. And so that is all very, very inspiring. It was great to do the town hall teleconference and hear from so many of you. And it was quite clear that a lot of people are very concerned about contracting COVID and also about the social distancing aspect, that they're not seeing enough of it, that they're concerned that people, especially as the weather warms up, will be doing less of it. I was out and about a little bit this weekend. I grocery shopped for my mom and my own family, so I saw a lot of people out, but I have to say I did see a lot of the social distancing going on, and that's something that I think we really need to stress as the weather is now getting better. People are really feeling the cabin fever and wanting to get out, but this is the time when we need to be doing it more so than ever. I firmly believe that each of us is a soldier in this battle against COVID, and we need to continue those social distancing practices. And talking about the good in the community, a lot of us are wearing masks that businesses and individuals have volunteered to make. We hear so many great stories. We did a fund drive or a donation drive to help people pay for their utilities, and we've raised over $120,000 in a week. We had one gentleman donate $1,000 twice, and we wanted to follow up with him to see if that was a mistake. We called him and he said, "You know what? It was a mistake, but you guys are doing such a great job in our community. Please keep that other $1,000. So much good is going on. It's very, very inspiring. A couple of the questions that I wanted to answer from the teleconference that we didn't get to is, speaking of which grocery shopping, one listener wanted to know why there were so many people in the grocery stores and the pharmacies. Those are still essential businesses. And the one thing that I like to see, especially on the grocery side of things, is that more and more people are having their groceries delivered or they're picking them up. And the grocery store that I was in, social distancing was in place. There were markers on where you should be when you're ready to go check out, and some grocery stores are even limiting the number of people that can go in at one time. So those are all very good things. And then the other question is, once they release us back into the community, will it happen all at once or will it trickle in? And that's a great question. It's an ongoing issue that we're talking about daily. What does it look like when we open the economy back up? And it will be in increments. It won't be all at once, but we need to make sure that it's backed up by data. And then when we do start opening segments of the population or of the economy, we need to be tracking that data even more so to make sure that we don't have an uptick on cases and we don't see another wave of COVID come into our community. So thanks so much for joining us.
Hello, I'm Spokane Valley Mayor Ben Wyck, and I also want to go through and say that we have been doing a lot, and the community members have been stepping up greatly for the community. But we really need to continue to make those, to make that commitment. It's important to step up for our community and our economic health. So continue, if you're able to be able to, in a position to order up Spokane Valley, order up Spokane if you're out and supporting our local businesses, or masks. If you're out in the community and you're going out, it's not to prevent yourself from getting the disease as much as it is to prevent you from spreading the disease. And so as Dr. Lutz has mentioned before, a lot of times people are asymptomatic or not showing signs, but they are actually able to spread the disease. And so we want to continue people to step forward and do that, and also be able to, if you're in a position, to be able to continue to help Meals on Wheels or do the food bank and things of that nature to help our community. And some of the questions I've been asked are, why have community leaders requested that residential construction be deemed essential? Well, residential construction is in a high demand right now. We have actually less than 2% vacancy in rental units throughout our community. And the demand on housing, we're in a housing shortage right now in our community. And so the demand is very high. We want to be able to get people in homes and keep them in homes. There's been a number of people that have reached out that have sold their existing home because their construction was going and they were getting close to the end of their building for their new house. But now with the construction on pause or on hold, they're not able to continue that construction to get their house completed. So they're kind of in a spot where they don't have a home to go to. And also within that industry, there are ways to be able to do social distancing, to be able to meet the requirements and regulations for that. And so that's where a number of us, mayors and community members, have asked the governor to kind of reconsider the essential business qualification for residential construction. The second question was, does the 6-foot distance order include the stay-at-home order? Those are actually two different things. In my mind, the stay home, stay healthy is what the governor has asked us all to do, and that's very important. But if you are having to go out into the community to do your essential shopping or things you need to get done, we are asking you to do the 6-foot distance to do the social distancing to keep the spread down. And so they're very similar, but a little different. And then the third question I have is, how do we make sure people are following the rules? And this is where we all need to work together. I know we can do this. Everybody has the ability to make them go through, and we need to trust each other. I mean, we're all in this together. We can all get through this, and we're asking you to do the right thing as we go through this time. That's all I have. Thank you.
Hi, I'm State Senator Andy Billig, and glad to be with you today, and glad to be standing with these community leaders working collaboratively on behalf of Spokane and the Spokane region. You know, I think it's important that we acknowledge that these are difficult days for many people. Certainly difficult if you've had a family member that has contracted the virus, and our hearts go out to all of you. Also difficult for business owners, for workers, for students, and for everyone that is concerned about their physical and financial well-being. The good news is that what we're doing is working, and I want to thank everyone that is contributing to our collective effort to control this virus by staying at home. Thank you also to all the people that are working in the face of danger, the public health workers, the healthcare professionals, the first responders, grocery store workers, the media, and many others. So my job as a legislator, and all of the legislators in our area, has several parts. First, we're working to assist in the coordination of state and local efforts to control the virus. Second, we're working on plans to restart our economy when it's safe to do so. And third, we're here to listen to your feedback and respond with support and information as you may need. So to do our job, we need to hear from you, and that's why that telephone town hall was so important. I was given two questions to answer as well. The first one is, why are activities like fishing and golfing closed? Well, the governor's stay home, stay healthy order requires people to stay at home except to do essential activities or to do outdoor activities close to home like walking or biking. So almost all activities are restricted, and that includes fishing and golfing. And the reason for restricting these non-essential activities is to reduce as much contact as possible. Because we know when we reduce contact, we are controlling the virus. And when you think about people congregating at a parking lot or a boat launch or playing golf and touching a pin or touching a sand rake, those are all opportunities for virus transmission. And we know the fewer interactions we have with each other outside of the household means the sooner we'll control the virus and the sooner we can get back to all of these recreational activities. And the second question that I was asked to answer, who made the decision to keep open marijuana stores? So the decision was made by the governor as part of his stay home, stay healthy order. And I believe the main reason that cannabis stores were allowed to stay open is that there are a lot of people that use cannabis medicinally. And so it's essential to those that rely on THC or related products for a medical reason. Hope that helps with answers to those questions. Appreciate you all staying in touch, and we'll keep doing our part to bring as much information as we can for you. Thank you.
So thank you to all of our speakers for their time today and during the telephone town hall on Wednesday night. We have time for just a couple of extra questions, so I'm going to turn it over to our moderators for any additional questions that we have.
Our first question will be for Mayor Woodward, and this is a question that came from the teletown hall last week. What is the best way for an individual to get answers about questions regarding financial impacts to businesses and individuals?
That's a great question as I try to take all this off. We understood that, there are so many resources out there right now and services to help people, state grants, federal loans. It all can be quite daunting and overwhelming about where to go and how do you navigate through all of that. So we started regionally a financial helpline, and it is staffed by our librarians, which is a perfect partnership. Librarians jump to the chance. We've got 20 of them who signed up, and they are going to help people live person on the phone. Do you happen to have the phone number for that? 625... Yeah, 625-6650. If you call, you'll get to talk to a live person, a librarian who will connect you to some of the resources and the service programs that we have, whether that is somebody who is experiencing just a financial hardship because they can't pay their utilities, or a business that wants to get connected to a grant or a loan of some kind. So it operates Monday through Friday from 8 to 5. So a great resource. Again, the financial helpline 625-6605. 50, sorry. Too bad it's not. Okay? Yeah. 625-6650.
All right, thank you all for joining us this morning. That concludes our Facebook Live for this morning. We'll be back tomorrow, same time, same place. Thank you.